Hello, my dear students. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. I've been receiving a lot of requests from students saying that they want me to create more MCQ videos. So I've created this one about the thyroid gland. Come, let's solve MCQs. So, what is the principle behind VB anatomy MCQs? See, what we do is we help you to solve the MCQ. We help you to understand why A, B, C, D are correct or wrong answers. But we also give you something called notes. So, there's one single sheet which has notes written on it, which will give you a lot of information in very short format. You use that to solve MCQs next time. Okay? So, this is something very unique what we do. And a lot of students have been calling me or messaging to me saying that this really helps them. I hope it helps you too. Right. So what is the idea behind solving MCQs with VB? You not only solve MCQs, but you also carry notes which will help you to solve MCQs in future. You get it? You solve MCQs with VB and then you get notes which will help you to solve MCQs in future. That's the principle. Come. MCQ 1. The thyroid gland enlargement grows downwards and cannot grow upwards because. Why does a thyroid gland enlargement grow downwards? Can it be gravity? Is it sandwiched between two muscles? Sternothyroid, inferior constrictor. Is it sandwiched between sternohyoid and middle constrictor? Sternohyoid is going way up. Middle constrictor is too deep. Sternocleidomastoid compresses it superiorly. Out of these four, according to me, B is the answer. It is sandwiched between sternothyroid and inferior constrictor. Remember, both sternothyroid and inferior constrictor are attached to the thyroid cartilage. Okay, I'll show you why B is the answer. Come. So now use this image as your reference image. See that this is the apex of thyroid gland. This muscle on top of it is sternothyroid. This muscle deep to it is inferior constrictor. Here you can see the same thing in a section. This is your thyroid gland, its apex. This is sternothyroid. This is inferior constrictor. See how between these two muscles, the thyroid gland apex is caught. Now this gland can grow downwards, okay, because it's free, but it cannot grow upwards because it's sandwiched between these two muscles. Understood what is the sandwich? The sandwich is sternothyroid on the outside and inferior constrictor in the inside. That's why B was the answer. We come to MCQ 2. The following pairing is correct except. So if you remember, thyroid gland has artery and nerve paired together, right? Superior thyroid artery, external laryngeal nerve, yes. If you remember, superior thyroid artery, external laryngeal nerve together pass downwards to the apical region of thyroid gland. So this option is correct. We are looking for an except. Inferior thyroid artery, internal laryngeal nerve. I don't think so. This is something which is a little bit challenging, incorrect. Internal laryngeal nerve, superior laryngeal artery, yes. Recurrent laryngeal nerve, inferior thyroid artery, yes. Remember, inferior thyroid artery is paired with recurrent laryngeal nerve. It is not paired with internal laryngeal nerve. So, according to me, B is the incorrect option or B is the answer. I'm going to show you an image to help you understand. So, that's what I'm saying, that we've got nodes. Okay, so this is your thyroid gland and you can see paired structures here. See, this is internal laryngeal nerve, superior laryngeal artery, piercing the thyrohyoid membrane to go inside to the larynx. So, that's one correct pair. This is your superior thyroid artery and external laryngeal nerve going towards the apex of thyroid gland. This is your inferior thyroid artery and recurrent laryngeal nerve coming up from below. These are the three correct pairs. What they had done was they had paired the inferior thyroid artery with the internal laryngeal nerve, which are at the two poles of the larynx and cannot be paired together. Right. MCQ 3. Thyroid is enclosed in which layer of cervical fascia? Superficial fascia? No. Superficial layer of deep cervical fascia, investing layer? No. Middle layer of deep cervical fascia, actually we never use the term middle layer of deep cervical fascia, but sometimes they may use it, in which case I think this is a possibility. Okay. And deep layer of deep cervical fascia, if we call it the prevertebral layer, then this is also wrong. According to me, C is the answer. Yes. And let's take a look at an image to understand why. Superficial fascia is somewhere here. No thyroid gland there. Superficial layer of deep cervical fascia is here. No thyroid gland there. Middle layer or pretracheal layer is here, enclosing your thyroid gland. This is the prevertebral layer. Okay. So that's how they have used the term superficial, middle and deep from anterior to posterior. Thyroid gland is invested by investing layer of deep cervical fascia, no. Pretracheal layer of deep cervical fascia, yes. Prevertebral, no. Carotid sheath, definitely not. B has to be the answer. It's a very simple MCQ. Yes. Following structures are enveloped by investing layer of deep cervical fascia. Okay. Trapezius muscle, yes. Sternocleidomastoid muscle, yes. Submandibular salivary gland, yes. Thyroid gland, no. Why? Because we know thyroid gland is enclosed by pretracheal layer. Okay. We can use the image we saw earlier again. See, this is your trapezius muscle enclosed in investing layer. This is your sternocleidomastoid enclosed in investing layer. But this is your thyroid gland enclosed in pretracheal fascia. Okay. So that's how you have to go back to your notes and use them for purpose of revision. Okay. And for purpose of clarity. Use the notes. Don't just solve MCQs. It makes no sense to remember options. The sense is when you know the anatomy. Then it makes sense. Okay. Come. Let's move forward now. MCQ 6. During total thyroidectomy, that means you're removing the thyroid, a set of nerves supplying sympathetic fibers to the gland was damaged. Sympathetic fibers. Which of the following manifestation is most likely to be seen in a patient? Will you see vocal cord paralysis? No. Vocal cord paralysis would be if the recurrent laryngeal was cut. Would the patient have dysphonia? Again, no. Horner syndrome? Yes. Because Horner syndrome is a manifestation of loss of sympathetic. Correct? Transient hypoparathyroidism, again you would have to inadvertently cut your parathyroid gland to have this, right? So C has to be the answer. Let's see if we are correct. Yes. Now this is the point where you should quickly revise the Horner syndrome. Should you just say, oh great, I did it, wow, wow, very nice? No. You have to go and understand why Horner syndrome, what is Horner syndrome. So, Horner syndrome is caused by disruption of sympathetic supply to the eye and that side of the face. So, your eyes will be drooping, ptosis. Okay, because sympathetic supply help to elevate the eyelid. So, loss of sympathetic, patient will have drooping eyelids. Meiosis, pupils will be constricted. Now, remember, sympathetics are pupillary dilators. But Edinger-Westphal nucleus through oculomotor nerve causes pupillary constriction. Okay, so there will be pupillary constriction. And hydrosis, loss of sweating on that side of the face. You remember sympathetics cause sweating. In ophthalmos, the eyes look to be sunken inside because of weakness of orbital smooth muscles. So that is Horner syndrome. Revise it and move forward. MCQ 7. Which gland basically regulates and controls the actual activity of thyroid? Is it pituitary gland stimulating, giving TSH? Yes. Is it hypothalamus? Hypothalamus gives TRH, which causes the pituitary gland to release TSH, which controls thyroid activity. So, in short, both are involved. Option C is the correct answer. Both A and B are involved in the regulation of thyroid gland functioning. MCQ 8. Which of the following disease is not related to thyroid gland? Myxedema? Yes, it is related. Cretinism, yes, it's related. Acromegaly, no. If you recall, acromegaly is related to pituitary gland. Goiter, yes. So the answer is acromegaly. What is acromegaly? Yes, C is the answer. Question is, what is acromegaly? This is the time for you to remember. Acromegaly is it's a hormonal disorder affecting the adults caused by excessive production of growth hormone due to a pituitary tumor. So what will happen? Patient will have abnormal growth and enlargement of body tissues. So this is how you solve MCQs, by also understanding why not acromegaly. Then only it makes sense. MCQ 9. What type of epithelium is present in thyroid follicles? I don't need to tell you that, I know you know. But anyway, simple cuboidal epithelium, B is the answer. Take a look at this image. This is a thyroid follicle. You can see the colloid and you can see the beautiful simple cuboidal epithelium lining the follicle. MCQ 10. Which cells produce calcitonin? Calcitonin is produced by C cells or parafollicular cells. Yes, A is the answer. Take a look at this diagram of thyroid gland. You can see the parafollicular or C cells here. While the thyroid gland will release T3, T4, the parafollicular cells or the C cells will release calcitonin. Okay. MCQ 11. What are the types of cells found in parathyroid gland? Does it have alpha and beta cells? No, alpha and beta cells I think are present in pancreas. Does it have chief cells and oxyphil cells? Yes, it has chief cells and oxyphil cells. Does it have parafollicular and follicular cells? No. Who has parafollicular and follicular cells? Thyroid gland. Pituocytes and basophil cells present in pituitary gland. So when you're solving this, understand not only what is the correct option, but also understand which gland has the other types of cells. Then it makes sense. B is the answer. Lymphatic drainage of thyroid gland is mainly sublingual nodes, submandibular nodes, deep cervical nodes, submental nodes. I think it should be deep cervical nodes. Option C. Yes. Let's understand quickly the lymphatic drainage of thyroid gland. This is your thyroid gland. When it drains upwards, it goes to prelaryngeal lymph nodes and jugulo-digastric lymph nodes, deep cervical. When it drains downwards, it goes to pretracheal lymph nodes and to lymph nodes along the recurrent laryngeal nerve. This is lymphatic drainage in one shot. What are Delphian lymph nodes? This is a very lovely part of anatomy when anatomy begins to meet history. Okay. See, what is Delphi? Delphi is a city or a small place in Greece. So why is this lymph node being called Delphian lymph node? So there's one single lymph node present in the just above your thyroid gland, just above the isthmus, between the two lobes. But if in cancer, this lymph node is affected, it is indicative of increased risk of cervical lymph node metastasis. Basically, it is indicating aggressive tumor biology. Why Delphi? Remember, in those days, there were women called as oracles. Okay, what was the job of an oracle? Oracle would give prophecy. Okay, so now this Delphian lymph node is prophesizing the aggressive tumor biology. Isn't it beautiful? Beauty in anatomy is the fact that it's been going on for thousands of years, and somehow, sometimes, even mythology comes into anatomy and gives you a little moment of break. Delphian node, asked as a MCQ in your NEET PG. MCQ 13 has come in NEET PG. Delphian lymph nodes are prelaryngeal lymph nodes, occipital lymph nodes, celiac lymph nodes, none of the above. The answer is obviously prelaryngeal lymph nodes. MCQ 14, again a NEET PG MCQ. Parathyroid gland is implanted into sartorius, supinator, deltoid, brachioradialis. Now this you can only answer if you know about it. Question here is, Why do you want to implant parathyroid? Where is it most commonly implanted? Answer is D. Yes. Let's briefly discuss why we have to implant parathyroid glands. So what they do is they do auto-implantation of the parathyroid gland in the person. The purpose is you may have unintentionally removed it during thyroid surgery, or you want to put it in the body so that it continues to function. Benefits are it preserves the parathyroid functioning and it reduces the risk of hypocalcemia in that patient. So, parathyroid autoimplantation commonly done in the muscle brachioradialis. MCQ 15. The hormone that controls level of calcium and phosphorus in the blood is secreted by? Is it thyroid gland, parathyroid gland, pituitary gland, thymus? Obviously, it is B, parathyroid gland, which secretes parathormone, which is responsible for balance of calcium and phosphorus in the blood. It therefore also decides how much of calcium should be deposited in bones. MCQ 16. What hormone does the parathyroid produce? Is it calcitonin? No. Calcitonin produced by thyroid gland. T3, T4? No. Produced by thyroid gland. Parathormone? Yes. Produced by parathyroid. Insulin? No. Produced by pancreas. Simple, easy MCQs. Unfortunately, all MCQs are not that easy. There. So this is a kind of quick note I give so that it helps you to quickly revise. Let's go to MCQ 17. What is the vertical extension of thyroid gland in relation to vertebrae? So if this is your thyroid gland, how many vertebrae does it cover? C4 T1, not likely, it's not that large. C5 T1, yes. B is the answer. We've been learning this right from day one when we studied thyroid gland. C5 to T1. Now this is very interesting. A 46-year-old man has puffy skin and is very lethargic. Puffy skin, lethargic, hypothyroidism likely. His plasma TSH concentration is low. There. Hypothyroidism. Increases markedly when he is given TRH, thyrotropin releasing hormone. What is the most likely diagnosis? Hypothyroidism, hyperthyroidism. Okay, so I'm going to talk about these two only. It is definitely not hyperthyroidism. So let's get rid of these two options. Okay, so hypothyroidism due to abnormality of hypothalamus, hypothyroidism due to abnormality of pituitary. He improved when TRH was given. That means TRH is less. So it's likely to be abnormality of hypothalamus. Let's check if A is the answer. Yes, it is. Sometimes you have to work it out. Take a little time to understand the problem. Following is true for parathyroid gland. Usually 2 in number, no. Develop from second and third pharyngeal pouches. Actually, they develop from third and fourth pouches. Migrate caudally in the neck in normal development. Yes, this appears to be correct. Secrete parathormone and calcitonin. No, they don't secrete calcitonin. They secrete only parathormone. So I think C is the answer. Yes. Come, let's understand this a little better. So here is the development. Here you are seeing the third pouch. How the third pouch gives rise to the inferior parathyroid gland and the thymus. The fourth pouch gives rise to superior parathyroid gland. Okay. So this is the bit of note that you need to carry with you for the next option. Inferior parathyroid gland develops from which pouch? Obviously, third pouch. Answer is C. MCQ 21. Which of the following statements regarding anatomical relations of thyroid gland are true? Middle thyroid artery intimately related to superior laryngeal nerve. I am not sure at all. Superior thyroid artery is a branch of external carotid. I am very sure of this. Thyroidea, EMA arteries are found in approximately 80%. Actually, they are not that common. This is something I don't think is correct. Parathyroid may often lie within the skin. No, parathyroids don't lie within the skin. Often is definitely wrong. So I think B is the answer. Yes, it is. Come, let's understand a little bit about this. This is your common carotid artery here, dividing into internal carotid and external carotid. Internal carotid continues into the skull, does not give any branches outside. External carotid now divides into 8 branches, which are as follows: ascending pharyngeal, superior thyroid, lingual, facial, occipital, posterior auricular, superficial temporal, and maxillary. This is a quick revision of branches of external carotid. Okay. Moving on to MCQ 22, which is coming NEET PG. Right recurrent laryngeal nerve loops around the following artery. Right recurrent, does it loop around right subclavian, right axillary, right external carotid, right superior thyroid? Right subclavian, very simple. Yes, A is the answer. Take a look. Now this is your right vagus, and therefore this has to be your right recurrent laryngeal nerve. You can see that it is looping around right subclavian. Use this image to understand how your left recurrent laryngeal nerve loops around the arch of aorta. MCQ 23. The principal blood supply to parathyroid gland is which of the following? Parathyroid gland is always supplied maximally by the inferior thyroid arteries. There are superior thyroid arteries given, a little bit supply comes from superior thyroid, but the principal supply is inferior thyroid. This is basic knowledge. Thyroidea ima arteries is wrong. Parathyroid arterial branches directly from external carotid is also wrong. D has to be the answer. Yes. So just understand that parathyroids, superior is supplied 85% by inferior thyroid, 15% by superior thyroid. Inferior parathyroid is completely supplied by inferior thyroid. Why should we know all this? We should know this because when the surgeon is looking for a parathyroid, he basically traces the inferior thyroid artery, which is able to help the surgeon reach the parathyroid glands. Let's begin MCQ 24. Development of thyroid gland begins in which week of intrauterine life? Remember, thyroid gland is one of the earliest glands to develop, has to be the 4th week. 12th, 15th, 4th, 7th. 4th week is when the thyroid gland begins to develop. Answer is C. MCQ 25. Thyroid gland develops from ectoderm, mesoderm, dorsal gut endoderm, ventral pharyngeal gut endoderm. Now remember, it comes from the tongue. Okay, take a look at this image. Yes, D is the answer. I'll show you why D is the answer. Come. So this is the ventral portion of the pharyngeal gut. Behind will be the dorsal. Developing in this ventral region, you can see this median rudiment, which descends downwards, finally developing the thyroid gland. This is your thyroglossal duct. That's why ventral pharyngeal endoderm is the development of thyroid gland. MCQ 26. A patient underwent left hemithyroidectomy. Okay, left side thyroid gland is removed. Post-operatively, she begins to develop a weak and very breathy voice. What is most likely? Just remember one thing. Whenever a person has a voice problem, okay, breathy voice, typically it's recurrent laryngeal nerve. Okay, let's see what are our options. Damage to left internal. Remember, internal laryngeal is not motor to larynx. Internal laryngeal nerve is sensory to larynx. So this is not going to be the answer. Damage to left recurrent laryngeal nerve, very possible. Injury to inferior thyroid is possible. Accidental removal of left parathyroid. Now this is possible but not as important as damage to left recurrent laryngeal. So B has to be the answer. Sometimes you just have to know these things. MCQ 27, following are branches of thyrocervical trunk. Remember thyrocervical trunk? Branch of first part of subclavian, giving rise to inferior thyroid, yes. Transverse cervical, yes. Subscapular, no. Subscapular is the branch of axillary artery. Suprascapular, yes. Let's take a look whether we are correct. Yes, C is the option. Now here you are seeing a bit of the neck. Here's your subclavian artery, first part, third part already marked. This is your thyrocervical trunk, giving rise to inferior thyroid artery, transverse cervical artery, suprascapular artery. No subscapular artery here. Okay, right. MCQ 28. Middle thyroid vein drains into internal jugular. Middle thyroid vein is here. It cannot drain into facial. Left brachiocephalic, no. Internal jugular likely to be correct. External jugular, no. C has to be the answer. I'll show you why. So here's your thyroid gland. Superior thyroid from it drains into internal jugular. Middle thyroid vein clearly seen draining into internal jugular vein. The inferior thyroid vein drains into the left brachiocephalic vein. That's why the left brachiocephalic was given the option. Middle thyroid vein drains into internal jugular. Just for your knowledge, there is a fourth thyroid vein, the vein of Kocher, which also should be looked for, which drains into internal jugular, sometimes causes massive bleeding in thyroid surgeries. MCQ 29. During thyroidectomy, one should avoid damage to or removal of the following except. So I should not remove the following except. I should not remove parathyroid gland, no doubt. I should not remove inferior thyroid because that would cause loss of parathyroid glands which are supplied by it. I should not remove isthmus of thyroid gland. No, I can remove isthmus of thyroid gland. I should not remove recurrent laryngeal or damage it, obviously, because you can't operate on thyroid gland and give a free hoarseness of voice to the patient. Patient won't allow that. Right, so C has to be the answer. Let's come to the last MCQ for today. A pediatric surgeon has cut open the sternum of a child during surgery for congenital heart condition. So the child is quite small and finds a lobulated structure lying immediately deep to it. What can this be? Can it be thyroid gland? Possible. Can it be submandibular gland? Can it be submandibular gland? No. Can it be lung? Possible. Can it be thymus? Yes. Most likely is thymus because, as you know, thymus descends down into the region just behind the sternum. So this lobulated structure the surgeon is looking at is likely to be the thymus. Yes, D is the answer. So students, I hope you enjoyed and learned a lot from solving these MCQs. If you have any doubts about any of them, please feel free to call me or email to me on vbanatomy.main@gmail.com. So I look forward to my creating some more MCQ series for all of you. Keep watching, keep learning. Please like and subscribe my channel, share your thoughts, pass comments, ask doubts in the comment section and share this with your friends. I'm making these videos specifically for all of you. Please learn from them. I enjoy taking this class. I hope you learned too. Thank you. Bye.